Okay, we're going to talk about some of the decision trees involved with a breast patient. A breast patient comes in and says, I want my breast enhanced and I want them to look better. So I look at the patient and I say, well, she looks like she has a C cup, so what are we really talking about here? And so sometimes it's a wonder bra, and they say, well, this is not what I look like, doc. And of course, we're going to get to that when we examine them. But the decision tree sort of goes like this. In a bra, without an enhancement, without gel inserts, without a wonder bra, are you happy with the volume, the size of your breasts? If the answer is yes, then more than likely you need a breast lift. If the answer is no, then you need an implant or fat grafting to your breast to get the volume you want. And most of the time we're using implants. Most of the time a gel implant. But if you have enough breast tissue, or if you're fuller figured, a saline implant is often going to be okay. There are several different kinds of implants, by the way. There's round, there's texture, there's high profile, there's moderate plus. And I usually use round implants. I usually use moderate plus, but sometimes I'll adjust depending upon your body frame and your chest size. Once I examine you and determine whether you have droopy breasts, what the texture of your breast tissue is it very, very soft if you had some babies, or do you lack enough breast tissue, then we start deciding, do you need a lift? Do you need an implant? Can we do both together? Do we need a lift with an implant later? Or, like I said, can we put them together at the same time? Sometimes when we do a breast lift and we fold the breast tissue into itself, that will accomplish the appearance of a breast augmentation with a lift. So those are some of the decision trees and decision patterns that I'm going to go through when I look at a patient. The other things I'm going to look at when I look at a patient are their chest wall. Some chest walls go in, some go out. Some are asymmetric. Some breasts are just frankly asymmetric. There's a bigger breast on one side, a smaller on the other, and those are some of the things we'll tackle together to put together sort of a customized plan for you. Maybe one breast gets reduced, maybe one breast gets lifted with different techniques, maybe sometimes different size implants. Mostly I like to get you to both breasts the same size and lifted and looking the same before we put the same size implants in. Otherwise, if you're a person whose weight fluctuates, for example, then 3 years from now, perhaps you're 20 pounds heavier or 20 pounds lighter. That's the life cycle you go through. When you have a much larger implant on one side than the other, you're going to get out of balance because one breast is going to gain a lot more than the other. So those are some of the little things that I'm looking at when I evaluate a breast enhancement patient.